Hey y'all, welcome back to my channel. Today we're going to discuss coronary artery disease. We're going to look at some of the signs and symptoms, the differences between coronary artery disease and an MI, and also the risk factors and what you're supposed to do in the nursing process. And lastly, we'll go through an NCLEX question and see if you can get the answer correct. Okay? So let's start with the case study. This is Mrs. Juliana Silva. She's a 60-year-old woman who came in with a chief complaint of chest pain and shortness of breath. She presents the emergency department with a 2-day history of intermittent chest pain, described as a pressure-like sensation in the center of her chest. The pain radiates to her left arm and is exacerbated by exertion. She also reports increasing shortness of breath, particularly during minimal activity. She denies any fever, cough, or recent illness. Her past medical history consists of hypertension, hyperlipidemia, type 2 diabetes mellitus. She's a retired school teacher, previous smoker, but she quit 10 years ago. She reports a sedentary lifestyle, a family history of CAD. Her father died of a myocardial infarction at age 62. Current medications, lisinopril for hypertension, atorvastatin for hyperlipidemia, and metformin for diabetes. On physical examination, blood pressure is 150/90, heart rate 92 BPM, respiratory rate 20 breaths per minute, and on auscultation, she has a regular heartbeat with no murmurs, clear lung sounds, mild edema in her lower extremities. So on the left side of this graphic, when we're talking about CAD and what's actually happening inside the chest, on the left side of this graphic, you can see two arteries, one in which the blood is flowing freely and the other in which the blood is kind of struggling to make it through, and so it is not flowing freely and is actually coming out in drops. This shows an obstruction. So on the right side of the screen, you will see the lumen view of the arteries. You will see it as if you are facing the artery straight on or head on. And what you're seeing here is the progression of how the fibrous plaques start to form, the fatty streaks start to form due to high cholesterol and other things inside your system that accumulate. And what this does is it starts to clog up those arteries and prevents the blood from flowing freely. When it becomes completely blocked, then you have a heart attack or an MI. And here we have the main symptoms of coronary artery disease. They're very similar to other heart conditions. So you have your nausea, your vomiting, your diaphoresis, your lightheadedness, presyncope, or dizziness, vertigo. You will also have some shortness of breath, pain in other areas of the body, and chest pain. Chest pain is the main symptom of coronary artery disease or angina. Let's talk about the difference between coronary artery disease and an MI or a heart attack. So the best example that I can give you is if you think of traffic. When you are in traffic and the cars are moving slowly, that is comparable to coronary artery disease. When traffic suddenly stops because someone got into an accident, a really bad accident, and everyone is at a standstill, that is an MI. An MI is a blockage. Coronary artery disease happens over time, and it starts as plaque starts to build up, and it causes the symptoms. Now with MI, it is sudden. It is a blockage. It's a sudden standstill. If we were talking about traffic, plaque has totally blocked that lumen, and that accident is totally shutting down the freeway. You will notice that the symptoms are very similar, and the extra two that are on coronary artery disease is fatigue and palpitation. So it's not uncommon to see fatigue and palpitations with myocardial infarction as well. Now these are the main risk factors for coronary artery disease. These are the main risk factors for coronary artery disease. You have your age, your family history, your gender. Mainly males will have a risk factor for coronary artery disease, and it does present differently with women as well. You have cardiac issues such as hypertension or hyperlipidemia or high cholesterol, diabetes, obesity, diet, and stress, but also smoking. So the one thing you want to note here is that the red risk factors are modifiable. So if you just fix those things, eat right, diet, exercise, reduce your stress, cessation of smoking or stopping smoking, you will greatly increase your heart health and reduce your risk of having coronary artery disease. So here's our nursing process, and let's start with ADPIE. And the A in ADPIE stands for assessment. Yes. So first of all, we're going to assess the chest pain or the angina using our PQRST, which means provoking. The P stands for provoking. What provokes it and what stops it? What is the quality? Is it crushing? Is it a stabbing pain? Does it radiate? Does it travel to other areas of the body? The severity of it. On a scale from 1 to 10, how severe is your pain? Or 0 to 10, because sometimes I don't feel nothing. And the timing. How often does it happen? Does it come back? Things of that nature. So we definitely want to assess the chest pain. So we want to take our vital signs and note what the signs are for our cardiac vital signs. So our blood pressure, our heart rate, we want to know. Special thing to note is our orthostatic blood pressure. Is it tremendously different when we stand up versus when we sit down?
What?
How much does the blood pressure differ by? We also want to inspect our skin. We want to inspect the patient's skin, the extremities, and look for any jugular vein distension, which would mean that there's heart failure going on. We want to palpate the pulses and make sure that the pulses in the wrist are as strong as the pulses in our dorsalis pedis in the foot area. Now on auscultation, we want to note if there's any other heart sounds. S1 and S2 might be muffled and distant. Extra heart sounds will be S3, means possible heart failure, and S4 means possible, and S4 could possibly be heard during angina episodes or chest pain. You might hear a murmur, which could be valvular distension or VSD, valvular septal defect. And one thing to note is that auscultation really does take practice. So listen to all that you can online to hear the different heart sounds, but really hearing it and getting that practice in with the stethoscope on a patient that has any heart conditions can really help you to attune your ear to what it is that you're looking for. But not everyone will have an abnormal auscultation, so don't just go looking for that. So now, the D, diagnoses in ADPIE, these are the things that your doctor will order and you will see on the orders. In ECG, we want to know the heart muscle function and the valve function. We want to know if there's any wall motion abnormalities. There might be a stress test as well to see if there's any ECG changes during that stress test and any symptoms that come about when the patient is exercising. The gold standard for a diagnosis of coronary artery disease is a coronary angiography. Now, as far as planning goes in ADPIE, we want to look to reduce the patient's pain. We want to have adequate cardiac output and increase their activity and tolerance, while also giving them education so they are informed of why this is happening and how and what they have in their toolbox and in their power to control to help reduce their risk factors for coronary artery disease and improve their health. To go with that, the implementation is where you're going to implement your interventions. So what you plan to do, your interventions need to match what you were planning to do. So if you're planning to decrease their pain, you're going to look to have some nitroglycerin in the orders, some morphine in the orders. You're probably going to want an ECG on them because you want to know when those angina episodes are happening and what happens during those angina episodes. And you want to promote rest and relaxation as much as possible and monitor their vital signs, of course. If you're looking for them to have adequate cardiac output, you're going to monitor their fluid intake. So measure your I's and O's, which is your inputs and your outputs, and maybe have some fluid restrictions. depending on the orders. Diuretics, ACE inhibitors may also be on deck. And if you're looking to increase their activity tolerance, you're going to want to do this progressively and gradually. So you want to be proactive about taking vital signs before and after the exercise so that you have something to trend and compare it to, and initially be focused on energy conservation techniques. For education, you want to educate them on their modifiable risk factors, their diet, their exercise, their stress level. If they are smoking, stopping the smoking, treating themselves right, doing all the healthy things and making healthy decisions, things that they can control. Now, as far as evaluation, well, did it work? Did your interventions work? Is there progress? Did it help to improve the patient's health in any way? What is the evidence that it worked? That's something that you need to record also in your nursing plans. So make note of when and how often do your interventions that you implemented require evaluation.
Now, I thought I might incorporate some of the heart sounds. So these are heart sounds taken from the website Merck, and I'll leave that link in the description box below if you want to hear more heart sounds. So first we'll start with S3. And now S4. So hopefully these give you a little insight into what you're looking for. If not, please go visit that website to find some heart sounds.
These are the most common nursing diagnoses. You can read them here. In my nursing school, they told us never to list a risk of, unless it was absolutely necessary and there was nothing else. So I use that one lightly. Knowledge deficit is also probably one of the last ones, unless you cannot find anything else. But my nursing school asked us to pick 3. And for each nursing plan. For each nursing plan, we were supposed to pick 3 and do a nursing plan off of that. So anxiety, knowledge deficit, activity intolerance, and risk for decreased cardiac tissue perfusion would be one of the lesser ones that we would use, because decreased cardiac output, ineffective tissue perfusion, and acute pain or angina would most likely be the presenting symptoms. But go off of your patient at the time and see if they fit any of these nursing diagnoses. Also, take note that these are all very clear-cut and assumes that there are no other comorbidities that are exacerbating the problem. So those are other things that you might want to consider when you're doing your nursing care plan. It's time for a NCLEX question. Which of these statements indicate that the patient understands modifiable risk factors for CAD? Select all that apply. A, I should stop smoking to reduce my risk of heart disease. Restricting my activity reduces the A, I should stop smoking to reduce my risk of heart disease. B, restricting my activity reduces the onset of heart disease. C, I should drink alcohol because it prevents heart disease. D, there's not much that can be done to prevent heart disease. E, obesity is a risk factor that I can change to reduce the risk of heart disease. Select your answer, please. Now, if you chose A and E, then you are correct. Thank you for watching, and I hope that you found some value in this. Miss Juliana Silva, did we help you any? Oh my god, thank you so much. I was so upset, and now I'm feeling good. Thank you so much. Thank you for watching. Please like, share, and subscribe.